Good morning, everybody, and welcome to our daily COVID update. Today is the 3rd of August. It's a Monday morning. We hope you had a wonderful weekend, and we're ready to jump into the numbers. We're going to start at the board. We're going to take a look at the numbers for the state and Pinellas County in just a minute. It was another tough weekend, but let's take a look at the board first. So here we are back on June 16th. That's when the governor had reopened the state back on the 1st of June, and by June 16th we had already seen a pretty significant increase. We're coming out here to August 1st, and you can see that we've seen a continuation of that increase. What we're looking at here is the total number of deaths. Now, why I'm looking at this is if you look at the fatalities as opposed to the number of new cases, what we're seeing is, yes, it's still an upward projection, but it is not vertical, which is what you see when you look at the number of new cases. And so as we learn more about the virus, we are protecting those who are at the greatest risk. Acute care physicians are figuring out how to do early technician and effective treatment modalities. We are seeing the death rate decline, even though we're seeing a significant spike in the number of reported new cases. To talk about this morning is I want you to take a look at August 1st forward and what the experts are saying in terms of predicting either an increase or a significant increase. All models are showing an increase. If we look at this bottom line, that's the increase anticipated if we wear masks. If we look at the purple line, that's the projection of what would happen if we do not continue with restrictions, and the red is what happens if we move forward with either mask or restrictions. And so you can just see the effectiveness out here of wearing masks and of practicing good social distancing, and where we would be if we weren't following those recommendations. And this takes us out to November 1st. So fatalities is not a leading indicator, but a trailing indicator. And so the fatalities are occurring anywhere from 20 to 40 days after the leading indicator, which is the new cases. So that's why we're hoping to see somewhere out here, middle of September, 1st of October, a reduction in the number of new cases with the trailing indicator of fatalities following shortly thereafter. So this basically is the same chart. It's just we've expanded it out to look at a little broader period, and a couple of things I wanted to point out. So way back on March 17th is when we went into our restrictions, and you can see the immediate spike in fatalities. Remember, this is a trailing indicator, so it's running behind. We were able to get a handle by the middle of April, late May. We were able to get a handle on social distancing and mask wearing. You saw a dramatic drop. We got down here to June 1st. Governor DeSantis said, we're going to enter phase 1. We're ready to reopen. And now remember, we're looking at fatalities. The fatalities started to increase almost immediately upon the reopening. Because we're running 17 to 21 days lag time, that's consistent with what happened on June 1st. The deaths are continuing to fall. The number of new cases is continuing to rise, and the leading indicator precedes the trailing indicator. Using that same philosophy, you're going to see what's going to happen out here as we begin to get a grip August 1st, as we begin to get a grip on number of new cases. We're going to see the number of people who are succumbing to the illness dropping off significantly. So those two charts were a really good indication and created a picture of just how important wearing a mask is and what it can do to control the spread of the disease and slow this whole process. There's one other piece of the equation that's important, and that is social distancing. I want to show you a slide now on social distancing. So this is a chart on social distancing, and it is done through mobility. You often hear the term mobility. What it's referring to is tracking of your cell phone and seeing if it is leaving its location. So what that means is if you live here at Regency Oaks, your cell phone is reporting back to a cell tower and it's indicating that you are stationary. And what the experts are able to do is look at the number of times a day, a week, a month that your cell phone tracks you leaving the primary location for your data. And that's called mobility, and it gives us a real good bird's eye view of what's happening with people and where they're going and what's happening in terms of getting social distancing out in the community. So you can see back on April 1, this really after the peak and all the restrictions were put in place. By April 1, we had mobility down almost 60% of what it was, and then it slowly started to increase. Here we are on June 1st. It continued to increase all the way through July. It increased through August and then became sort of stable, and you can see all the way out through November. They're predicting that it's going to continue to increase, but overall that's going to be about a 5% increase of where we were back on the baseline. So wearing a mask and social distancing are the two primary controls that we use in preventing the spread of COVID. All right, so that concludes our COVID update for today. Look for us the rest of the week. Our schedule is Tuesday Talk will be tomorrow in the town hall at 10:30. Our forum meeting will be next Friday. All of that will be broadcast at the regular time starting at 1 o'clock on the day of the production. So have a great week, and I'll talk to you tomorrow. Hope to see you at Tuesday Talk. Thanks.